Welcome back to day 4 of our 26-day sickle cell awareness series. So far we have talked about sickle cell disease, what it is and how is it inherited. Today we are moving into something very important, which are the signs and the symptoms of sickle cell anemia, because knowing this can help families seek help early and manage the condition. So for us to start, I would like us to know that the symptoms of sickle cell anemia usually appear around the 6 months of age after delivery. These vary from person to person and may change over time. So some of these symptoms include 1. Anemia. Sickle cell break apart easily and die. Typical red blood cells usually have a lifespan of 120 days before they need to get replaced, but sickle cell usually die between day 10 to day 20, leaving a shortage in red blood cells, and this is known as anemia. So without enough red blood cells in the body can't get enough oxygen, so this causes fatigue, tiredness, and weakness of the body. The next is periodic episodes of extreme pain called pain crises are some of the major symptoms of sickle cell anemia. So pain develops when sickle cell shape block the blood vessels, as I said in our first episode, to the chest, abdomen, joint. So the pain varies with intensity. To some it lasts hours, some a few days. Some people have only a few pain crises in a year, while others have a dozen or more in a year. So a severe pain crisis hospital stay. Sure, you can see sickle cell patient lying in the hospital because of the level of pain. So there is always a stay in the hospital for them during this period of crisis. So the next one we have is sickle cell shaped red blood cells block blood circulations in the hand or feet of babies usually, so which cause them to have this swelling in the hand when they are born. But not all swelling are signs of sickle cell anemia. The spleen is an important organ in the body which serves for protection against infection. So sickle cell can damage the spleen by raising the risk of developing infection. So babies and children with sickle cell anemia commonly receive vaccination and antibiotics. So red blood cells provide the body with oxygen and nutrient needed for growth. So a shortage of these red blood cells, which provide this oxygen, is very noticeable when it comes to growth. Tiny blood vessels that usually supply blood to the eye can become plugged by these sickle cells. So they can damage a portion of the eye that processes visual images called the retina and leads to vision problem. So the next one is gallstone, which is formed by too much accumulation of bilirubin in the gallbladder. So the question now is, what are these bilirubin? These bilirubin are yellow compounds that are produced by the breakdown of hemoglobin from the red blood cells. And so when there's breakdown of this red blood cell, when there's too much breakdown of it tends to accumulate too much, giving a more workload to the gallbladder. So in order for the gallbladder to really function, what it does is it tries to solidify the other bilirubin. So by solidifying it is what we know as gallstone. So they can look as a tiny grain of sand, as we can see in the picture. They can just be one large stone, hundreds of tiny stones, or many other combinations. So it really blocks the flow of bile, which is released to help in digestion process. So if this block over a period of time, it can lead to damage to the liver and to the pancreas as well. Periapism. So in periapism, it always happens to the male, and sickle cell anemia can cause painful crisis. We know that. So during erection of the male genital, what occurs is the muscle in the genital area get filled with, so which cause the erection. But sometimes sickle cell patients have abnormal erection when, if there's a flow of blood to the genital area of the male, what it does, it causes um, a prolonged erection, which cannot be flaccid after a period of time. The genital area become erected, and it really and causing impotency after a long period of time. So in recap to everything we have discussed thus far, sickle cell disease can show up as tiredness, pain crisis, swelling in the arm and the feet, frequent infection, delayed growth, vision problem, and many others. So recognizing these early signs can help in better care and fewer complications. So join us tomorrow when we dive deeper into the pain crisis. What are they? What triggered them? And how family cope.